Hello and welcome, everyone. I'm Dr. Tom Chaney, and this is Living Health Live. Joining me on this show, as well as in my life and in our practice in Living Health Integrative Medicine, this is my wife, Dr. Stephanie Chaney, joining me. And we are your trusted source for the latest information to help you get and stay healthy naturally. We're super excited to be joining you regularly to take you on this adventure of a lifetime. This is a lifetime of great health. That's what we want for you. You're going to get some great information, strategies, latest research on how to live healthier, how to live a more active and healthier lifestyle. Just keep in mind that the information on this show, it's intended as educational information only. It's not designed to help you make medical decisions or a substitute for medical treatment. It's just to help you make more informed decisions about your health. And we're super excited today. We have a special guest on today's episode. This is Kevin, one of our patients. He's experienced treatment in our office, so we thought that we would have him on to share his experience, share what he was going through. And I'm going to turn it over to Dr. Steph. Go ahead, and it's all yours.
Yeah. Hi, Kevin.
Hi, Dr. Steph. Hi, Dr.
Kevin's
Tom.
patching in from his phone. I'll give a little brief overview, and then I'm going to ask you some questions, Kevin, because I want the audience to hear what the process has been like for you from before you got here to now. When I met you, it was probably about a year ago, right? Or has it been?
Yeah, a little over.
Yeah, maybe a year and a half ago.
Year and a half, give or take.
And
sure.
yeah, and you had somewhat newly been diagnosed with an autoimmune disease called Ankylosing Spondylitis. So I'm just going to explain what that is for our viewers. It is an autoimmune disease, and it's an autoimmune disease where there's inflammation of the ligaments and the joints, especially of the spine, from the neck all the way down to the SI joints, and other joints can get involved as well. In the spine in particular, over time, it can lead to a change in the posture, especially the neck falling and the head falling forward, and it can lead to eventual fusion. Any areas of the spine, including the sacroiliac joints, where this happens, it can be very painful and it can be very disabling. And Kevin's a young guy and was fortunate enough that he came to our office fairly soon after he was diagnosed. So why don't you, Kevin, just tell everybody what was going on before your diagnosis? Like, what were you feeling? What were your symptoms? Just generally what happened?
Yeah, sure. It started in the neck, the upper spine / neck area. And at first I just attributed it to, I was on my computer too long, looking down, made some adjustments at my desk and workspace, but that didn't go away. Was seeing a local chiropractor, doing some adjustments, and it just wasn't helping. And then the pain spread. My knees started really hurting, all the major joints, the knees, the ankles, the wrists, elbows, hips. And I knew something was up. It became very difficult to walk. I just recall walking up and down stairs was just an extremely difficult ordeal. I didn't know what it was. I started seeing doctors, getting x-rays, getting all kinds of tests. I started seeing a rheumatologist. And that's when I was diagnosed with ankylosing spondylitis. And I was devastated. Being a father of 3 young kids, you need to be able to have that movement. You need to be up on your feet. I didn't know if I was ever going to be able to run again, let alone walk normally.
Wow.
It was had quite an effect in my life. And short, the rheumatologist, he did several tests on me, started prescribing me medication. It started with anti-inflammatories, and then it went to immunosuppressants. And this is the type of immunosuppressant that you inject once every 2 weeks. Mm-hmm. And the story that I got was that I was going to have to be on those immunosuppressants essentially for the rest of my life. Those types of drugs, they had quite an effect on you. I always made sure that I didn't schedule anything important the day after I took that dose, because it just wiped you out. It helped a little bit, but I'm really glad that I took the path that I did. And that's when I went to see Dr. Steph, and my mom of all people actually found Dr. Steph and Dr. Tom. And we made an appointment. She was very supportive. She was very concerned.
Yeah, I think so. We do a lot of different treatments in our office, and we do functional medicine and nutrition, and we've got injection therapy, and we do IV therapy. And one IV therapy in particular that we do with most of our biotoxin, autoimmune, systemic inflammation patients is Ozone IV. And I think, if I recall, that's how your mom found us, because she had read about Ozone, and she was obviously desperately trying to help her son. And I think our office came up as one of the few places in our area, we're in Maryland, that does Ozone IV. And that's how she found us.
Yes, that's exactly it. And I know that type of treatment is unique. I know not every practitioner offers that treatment. So that's how she found your office and your practice. And I made an appointment. I figured I would give it a chance.
So you're dealing with this autoimmune disease. You're in a ton of pain. You're having a hard time just doing normal things like walking and just taking care of your kids. And so you meet with Dr. Tom, I think, initially, and we do lots of testing in the beginning, right? And we've done CIRS webinars, chronic inflammatory response webinars and whatnot, where we explain to our viewers like the complexity of biotoxins, right? So you and I started working together. We put a program together for you, and we did lots of different testing, and we narrowed down several sources of toxins that were likely triggering, right? Because our immune system's not naturally designed to attack ourselves. Usually we're going after something, right? We started you on Ozone. We started you on functional medicine. We started you on a food plan and a personalized supplement protocol. And so what was that initially jumping in? I'm sure that was quite overwhelming.
It was a little bit, but it was, certainly the condition that I was going through was very overwhelming. Yeah, we did go on this plan, and it was pretty rigorous. I won't sugarcoat it. It certainly took a lot of discipline, a lot of dedication. The diet that I was on, it was very, very strict diet. No red meat, no dairy, sugar, wheat, alcohol, even certain types of fruits and vegetables I had to avoid. But I kept on that diet for over 6 months. And it certainly wasn't easy at times, but I'm really glad I did it. And it certainly was a change of lifestyle. And I could just see the results. I could just see very quickly the improvements that this was all having on me. Was going in for ozone treatments at least once a month, sometimes once every 2 weeks, and just kept up with the supplements, the diet, the lifestyle. And it was pretty amazing how quickly my condition just improved. And I started on this in January. This was, I remember, like a start of the new year, new diet, new lifestyle. And, literally by July, I was in remission. And that's when I was able to slowly reintroduce certain foods in moderation.
You're mostly on.
Mostly on, but I'm able to enjoy that backyard barbecue every once in a while now. And by August, I was able to do a triathlon, which I never thought that I was going to be able to run again. Treatment started in January. By August, I completed a triathlon. So,
which means you were training for this triathlon before August, because I remember It was like a few months in, and you said, I feel good enough. I feel like I can actually start running again. And off you went and got back into running, and you were not having the ankle and the knee and the hip pain anymore. I was trying to think back to when you first started, and you were still doing that immunotherapy. And then it was a matter of, okay, like, how do I stop doing the immunotherapy? So what happened with the medication and eventually just not needing that anymore?
Yeah, so when I started on your program in January, I recall I did take a dose of the immunosuppressant.
I think you forgot or something. It was just like an innocent,
Yeah,
I kind of missed it.
yeah, yeah. I recall taking one in mid-January and then thinking that, okay, my next dose is in late January, and it may be because I forgot, or maybe because one of my kids got sick, and I know you're not supposed to take immunosuppressants
Right.
when somebody in your family is sick and you don't want to suppress your immune system. And so I remember skipping a dose. And then I remember thinking, okay, it's February, my condition is improving. I'm just gonna continue on, and I'm just gonna see where this takes me. I'm not going to take my next dose. And literally, I have not taken a dose since. And mind you, this was over a year and a half ago, and I've not had to take any dose of immunosuppressant since then. And I'm still in full remission.
So would you say that you are happy with your decision to take a leap of faith and jump into this crazy program with Dr. Steph?
Absolutely. I cannot say enough good things. And yeah, I would encourage anybody else having similar symptoms, having a similar condition, get help very quickly. I know Dr. Steph, you mention all the time. It was very fortunate that we caught this early and started treating this early. And so I just highly recommend get treatment as soon as you can to anybody having similar conditions.
Yeah, because once permanent damage, like once a joint is fused, right, we can't unfuse it. But if we can stop the inflammation that leads to the fusion really early in the process, then we can literally get somebody to stay fully functional. And so you say that you're mostly on, and we're looking at long term now, right? So you have like tools in your toolbox to keep the inflammation in check. You're always genetically susceptible to this condition. The idea is we stay in remission. So what are some of the things that you do now to just keep things in check and make sure you're always on the right path?
Yeah, I maintain the diet, maintain that the lifestyle for sure. I exercise regularly. I know that's very important. I maintain certain supplements. I try to keep stress out of my life as much as possible. But
3 kids.
3 kids and work and everything.
Stressful job. Yeah.
Yeah, I try to manage as best I can. But yeah, I just maintaining that lifestyle, keeping on the diet, being healthy, and just coming in and getting those checkups, getting those regular checkups.
Yeah. So one of the things that was helpful for us to figure out the right protocols for you, Kevin, was meridian assessment. That's something that I do here in the office with a special bioimpedance machine. And so that's something that we just rechecked you on, and there's a few little things to tweak, but so much better than when you first came in, looking so much better. And so now we're just looking at a long-term kind of maintenance wellness protocol for you, just to keep you in a healthy state. You got a 2-year-old now. That's a lot of running.
It is. I couldn't even imagine keeping up with him had it been a year and a half ago. But anyways, I'm doing much better now.
And we kind of joke, this is one of those things where it's, yes, Mom, you were right. Good job, Bob.
She was. And she always is. Anyways.
It's kudos to moms out there.
I hardly ever doubt her.
Anyway. Yeah. So that's awesome. I'm super excited. And again, my wish, and I know now your wish, is that sometimes what we do here is like a last resort for people. They've been on the immune suppressing drugs forever. They had no idea there were other options out there, other treatment options, or this seems really weird and whatever. But it's like the sooner you can jump onto something and take action, the sooner you can get into remission, whatever that autoimmune issue is, and the sooner that you save the the tissues from permanent damage. Kudos to you for, like I said, taking that leap of faith and finding us and basically hiring us to help you.
Thank you very much. I really appreciate it. And yeah, really glad that we were able to connect.
Yeah. And is there any like final words of wisdom that you have for our audience and our patient base?
Just, I said before, and I'll say it again, get help as quickly as you can.
Mm-hmm.
Have somebody check it out. Don't be putting it off, because it's your well-being at stake.
Yeah.
So,
And it's an investment well worth it.
Absolutely. Gosh, absolutely.
Good. Thank you so much, Kevin.
Thank you, Dr. Steph and Dr. Tom.
Yeah, thanks for joining us. That's awesome that you did a triathlon. I didn't know that.
Mm-hmm.
Very good.
Yeah. Plan to do more. Anyways.
Awesome. All right. Well, you've been listening to Living Health Live with me, Dr. Tom Chaney, Dr. Steph Chaney, and thanks for joining us, Kevin. And we'll see you guys on the next episode.